even though eye twitching has been attributed various positive or negative meanings among the public, it is actually a health problem related to the eye muscles. Eye twitching, whose medical name is myokymia, is a condition of involuntary recurrent spasms or contractions of the eyelid muscles, usually the muscles called orbicularis oculi. Because it is quite common, it is not commonly seen as a medical problem, but it can be a sign of various eye diseases other than insomnia or fatigue. Although the condition is obvious for individuals with eye twitching, in some cases the eyelid may twitch so fast that it is not noticeable to others. Eye twitching usually occurs in the upper eyelid. However, there are cases where it occurs both on the upper eyelid and as an under-eye twitch. There is no obvious difference between a right eye twitch and a left eye twitch. An eye twitch typically occurs for 1 or 2 minutes, with a repetition every few seconds. In most cases, the eyelid contractions are very mild and feel like a slight pulling of the eyelid. However, in more severe cases, spasms can be strong enough to cause the eyelids to close completely. This is a different medical condition called blepharospasm. Twitching attacks do not have a specific period. Twitching attacks may come and go for several days. However, there may not be any sign of twitching for weeks or even months. Twitching is usually painless and harmless, but it can cause discomfort in everyday life. In most cases, twitching usually resolves on its own without treatment. In rare cases, however, eye twitching can be an early warning sign of a chronic movement disorder, especially if other parts of the face twitch at the same time or if uncontrollable limb movements occur. The cause of eye twitching is not always easily identifiable by the individual. Except in very rare cases, the cause of eye twitching is usually not investigated because it is not a sign of a more serious problem. The main causes of eye twitching: insomnia, fatigue, alcohol, tobacco or caffeine use, allergic reaction, infections around the eyes, environmental factors such as sun, wind or dust, corneal scratches, physical exertion, eyelid strain, impact, eye irritation and dry eyes, continuous and uninterrupted use of unfiltered computer screens, side effects of the medicines used, stress, cases where the twitching becomes chronic, i.e., continuous, are called benign blepharospasm. This chronic and uncontrollable blinking condition typically affects both eyes. Benign blepharospasm is more common in middle age and later. The exact cause of this condition, which is more common in women than in men, is unknown. However, it is thought that the conditions listed below may cause spasms: excessive use of alcohol, caffeine, blepharitis, inflammation of the eyelid, environmental factors such as sun, air pollution, wind and dust, all forms of tobacco use, light sensitivity, conjunctivitis, inflammation of the eye, dry eyes, stress, fatigue. Unlike twitching, benign blepharospasm, if left untreated, can worsen over time and eventually lead to vision problems. Problems can include blurred vision, sensitivity to light, and facial spasm. In most cases, eye twitching goes away spontaneously within a few days or weeks. However, if it persists for longer than a week or 2, identifying and eliminating the possible causes may be sufficient to improve the twitching. Reducing stress, fatigue and caffeine consumption, which are among the causes of eye twitching, are among the first measures to be taken. Accordingly, drinking less coffee, allocating enough time for sleep, eliminating dry eyes with over-the-counter artificial tear drops and applying a warm compress to the eyes when spasms begin will help reduce and eliminate eye twitching. If the eye twitching is caused by an allergic condition or environmental factors, avoiding this allergenic substance or environment will be effective. However, some medications prescribed by a doctor can help treat muscle twitching. In the treatment of benign blepharospasm, there are several types of medication prescribed by a doctor. However, these medicines will only provide temporary relief. In more severe and problematic cases of benign blepharospasm, it is possible to resort to surgical intervention for treatment. This surgery to remove some of the muscles and nerves in the eyelids is called myectomy. This surgery can also relieve the pressure caused by the veins pressing on the facial nerve, causing hemifacial spasms. The results of the surgery are permanent, but as with any surgical intervention, you can support us by liking the video, writing your thoughts on the subject in the comments, and subscribing to the channel for the development of the channel and more such content.